Anesthesia is a way to control the pain during the surgery or procedure by using the medicines called anesthetics, and it helps to control your breathing, blood pressure, blood flow, and heart rate and rhythms. Anesthesia may used to relax you, block pain, make you sleepy or forgetful, and make you unconscious for surgery. Besides general anesthesia, another form of anesthesia may provide only light sedation or use the injection to numb only a small area. लोकल एनेस्थीसिया कहलाता है, जो कि पर्टिकुलर पार्ट्स में हो रहा है, जनरल एनेस्थीसिया कहते हैं, और लोकल एनेस्थीसिया कहेंगे लार्जर रीजन में रीजनल एनेस्थीसिया फॉर योर बॉडी. वाई what are the risks and complications of anesthesia? Major side effects and other problems of anesthesia are not common, especially in people who are in good in health. But all anesthesia has some risk. For example, after general anesthesia, heart problem, pneumonia, sore throat, over vomiting can occur. With high dose of local anesthesia, the anesthetic can go into the rest of the body and affect your brain. After spinal anesthesia, some people get headache. Your risk depends on the type of anesthesia. Some health problems such as a heart or lung disease increase the chance of problem from anesthesia. Taking certain medicine, smoking, drinking alcohol, and use the illegal drugs can also increase the chance of problem. Stages of anesthesia. Depth of anesthesia has been divided into 4 sequential: analgesia, induction, second is excitement, third is a surgical anesthesia, fourth is a medullary paralysis. First is induction occur voluntary. Excitement is the period between the initial administration of the induction agent or loss of consciousness. During this stage, the patient progresses from the analgesia without amnesia to analgesia with amnesia. Patient carry on a conversation at this time. Stage second, delirium. Involuntary excitement is the period following loss of the consciousness and marked by the excitement and the delirious activity. During this stage, respiration and heart rate may become irregular. In addition, there may be uncontrolled movement, vomiting, breath holding, and papillary dilation. Since the combination of spastic movement, vomiting, and irregular respiration may lead to the airway compromise, rapidly acting drugs are used to minimize time in this stage. Reach stage third as fast as possible. Third stage, surgical anesthesia. During this stage, the skeletal muscle relax, vomiting stop, and respiratory depression occur. Eye movement slow, then stop. The patient is unconscious and ready for surgery. It has been divided into the 4 planes. It has been divided type and anesthesia, general anesthesia, regional anesthesia, local anesthesia. General anesthesia acts primarily on the brain and central nervous system to make the patient unconscious and unaware. It is administered by the patient's circulatory system by combination of inhaled gas, injection, drugs. After the initial injection, anesthesia is maintained by the inhaled gas anesthesia and the additional drugs through an intravenous line. Local anesthesia is the medicine given to temporarily stop the sense of pain in a particular area. A patient remains unconscious during the local anesthesia. For main surgery, a local anesthetic can be given administered by the injection to the site. However, when a large area needs to numb off, or if a local anesthetic agent will not penetrate deep enough, physician may resort to regional anesthesia. Regional anesthesia involves the injection of local anesthetic numbness around the major nerves and spinal cord to block the pain from a larger but still limited part of the body. You will likely receive the medicine to help you relax or sleep during the surgery. Major type of regional anesthesia include spinal, often used for the lower abdominal, pelvic, rectal, or lower extremity surgery. This type of anesthesia involving the injecting a single dose of anesthetic agent directly into the spinal cord in the lower back, causing a numbness in the lower body. Epidural and coidal anesthesia. This anesthetic is similar to spinal anesthetic. Also is commonly used for the surgery for lower limbs during the lower labor and childbirth. This type of anesthesia involving the continually infusing drugs through a thin catheter that has been placed into the space of surrounds the spinal cord into the lower back, causing the numbness in a lower body part. Nerve blocks. A local anesthetic is injected near the specific nerve or group of nerves, block the pain from the area of body supplied by the nerves. Nerve blocks most commonly used for the procedure on the hand, arm, feet, or legs. Example: a brachial plexus block may be used for your anesthesiologist to provide the anesthesia your entire arm or shoulder. Drugs. Drugs were used for local anesthesia: articaine, HCl, epinephrine, benzocaine, bupivacaine,